Welcome, everyone, to the latest installment of the American Society of Tropical Medicine and Hygiene's Fireside Chats. My name is Karen Goraleski, and I am the CEO of this society. ASTMH is the largest international scientific organization of experts dedicated to reducing the worldwide burden of tropical diseases and improving global health. Today, our ASTMH president, Dan Bausch, will be talking with Rajat Khosla, with the International Institute on Global Health at United Nations University, which is a designated UN think tank on global health, serving as a policy translation hub for UN member states, agencies, and programs. It was established by a statute adopted by the Council of the United Nations University in December 2005. ASTMH's leaders, members, and staff, we all recognize the importance of supporting principles of equity and human rights to ensure health for all. We're all looking forward to this conversation. I'll stop here and turn it over to you, Dan and Rajat. Welcome, Rajat.
Thanks, Karen. I'm glad to be here today and glad to be with Rajat Khosla. Karen gave his background, but as mentioned, Rajat is a lawyer who's been in decades involved in the intersection of global health equity and human rights, presently at the United Nations University in Kuala Lumpur, Malaysia, but previously roles as the Senior Director for Research, Advocacy, and Policy at Amnesty International, a Human Rights Advisor for the World Health Organization, and various other posts. So thanks, Rajat, for being with us today. Really happy to have you here. Society members will remember that, I hope they will remember that my president's address at the last annual meeting was on the nexus of health and human rights. So we're happy to further explore that topic with you. I'll plunge into the questions then. There are many issues of human rights in the world, but you often choose to focus on health. Why is that so important to you?
Thank you, Dan, for having me here, and great pleasure and privilege to join you for this conversation. Why did I focus on health as a human right, as something that I work upon? Much more by chance than by choice, I would say. In my early days as a lawyer working in India, the work that I was doing was focusing on slums and informal settlements, and looking at issues around forced evictions faced by slum dwellers in various parts of Delhi, where I used to live and work in as a lawyer. And one of the things that always struck me was how where you lived had such an important marker on what kind of outcomes you were able to achieve in your life. What kind of services were you able to access, whether it was health, education, water and sanitation, and so on and so forth. And as I started looking at much further and deeper into the work, the issues around inequalities in access to services became more and more profound in my life and in my career as a researcher working on legal issues on health and human rights. And therefore started coming into issues around health much more from inequalities and barriers to access services. And I was involved in certain litigations with the Indian Supreme Court on these issues. And then eventually, as I started working as an international human rights lawyer with the first UN Special Rapporteur on Health, is where my interest started crystallizing more as a career option. So by chance, came into the field of health, but then stayed on.
Yeah, great, thanks very much. Moving on then, the UN Declaration of Human Rights confirming the right to health in various forms was approved in 1948. And so the skeptic might say, what difference has that made? Can you cite some successes from that declaration? Where would we be without
it? I guess very, very lost. And probably our society with its inner core emptied out is what I would think if we did not have the Universal Declaration of Human Rights. And it's important to remember the UDHR came in 1948 out of the horrors of Second World War. It was the world coming together and saying, never again shall we withstand that kind of inhumanity against each other, and that we must do better. And hence came the the principles within the Universal Declaration of Human Rights and the covenants that came thereafter. Looking back, surely we could have done better. We could have done more. We could have done things very differently from where we are. And I think the events of the last few years have tested the resilience of humanity and of these founding documents, as it were. There have been successes, though, which should not be undermined. I think we have been able to prevent multiple conflicts and crises in the past because of certain documents like the Universal Declaration of Human Rights. The fact that we have been able to achieve commitments and to a large degree, a lot of progress in addressing xenophobia and racism owes its credit to the 48th Declaration. Women's full participation is another one of those consequences. Where we have lagged, unfortunately, is where in terms of its influencing implementation and domestic action in multiple fora.
Can I challenge you to go a little bit further in that and give us some specific examples of those successes? You gave some broad areas, but what conflict has been avoided because we have the declaration?
In terms of where we have achieved successes, I think the end of apartheid in South Africa, the Universal Declaration of Human Rights, and the following documents therefrom were pretty phenomenal in terms of influencing, and also how it influenced the South African Constitution that came out in 1996 as a consequence of end of apartheid. There have been multiple successes in the past that one could actually trace from, although they look very differently when we look at it right now. In terms of different crises that were averted because of the world coming down to the negotiating table, whether it is we looking at how we addressed the coming out of the Cold War, the addressing in terms of the nuclear proliferation in the decades that followed, and multiple other such successes can be traced back.
And do you worry now? It's a very complicated planet, of course, and a lot of human rights issues coming to the forefront. Do you worry that we're slipping back?
Yes. And I do worry enormously, as I think all of us do worry, in terms of whether what we have can withstand the kind of assaults that are being unleashed. Whether if you look at it from a conflict and crisis perspective, looking at Ukraine, Ethiopia, Afghanistan, or the events in Sudan in the last week, or what is happening or what happened with regards to COVID-19 and the kind of challenges on global solidarity and cooperation that we witnessed as a consequence of how the pandemic was dealt with and what it portrayed. But I think where we are finding the challenge the starkest, if I may, is in our inability to address the kind of existential crises that are coming out with from climate change perspective, and whether the international frameworks are able to provide us with the kind of guidance for implementation of action that can result in any meaningful change.
Thanks for that. Can you talk a little bit more about those international frameworks? You're a lawyer, of course. Do we have the frameworks that we need to find success in this realm, or what needs to change?
So, human rights in context of health have, of course, traced their origin initially to the Universal Declaration of Human Rights, and then subsequently to the International Covenant on Economic, Social, and Cultural Rights, which talks about famously the right to the highest attainable standard of health, and the language of which is interestingly very similar to what you have in the Constitution of the World Health Organization, which came about the same time as UDHR. But what is interesting is how the framework has been developed and unpacked in terms of identifying what are the responsibilities of governments, of state parties to these covenants to undertake to realize the right. And it isn't really rocket science. It's something that people working in public health are fairly familiar with. Is issues around availability of services, about accessibility, about the quality of services, etc. What is important is that when you look at it from an international human rights perspective, it provides you with a legal framework. It provides you with the responsibilities of states to respect these obligations and to take action to protect them against the violations committed by the third parties, but also take positive action in terms of allocation of resources that need to be put in place for these rights to be realized by everyone, everywhere.
Great, thank you. I want to change topics a little bit now and talk about technology. And so you can't pick up a virtual newspaper any day, I think, now without seeing the next thing that's come out, of course, especially for artificial intelligence. And how do you feel about the technological advances that we're seeing? Is this something that excites you or worries you with regard to health and human rights?
Look, technology and the technological evolution more broadly within the context of healthcare is transformational. There is no point denying it. I think the transformational capacity of what technology can bring in terms of making sure health services are available and accessible to the hardest of reach populations in under-resourced countries and contexts is true, and it can reach that potential. The challenge that we have is technology being developed and harnessed in the manner that it can do that transformational element or not. And this is where I start getting worried. I think we have almost had a fetish approach towards technology with the way we have approached it, in the sense that we have worked with blinders on, that we have had certain costs, certain gaps and blind spots that we have just ignored as transactional costs towards some utilitarian larger good that we are working towards. Unfortunately, as studies after studies are showing, there is huge challenges when you look at it from gender or you look at it from racism perspective, that these blind spots can exacerbate existing inequalities that these populations group are facing in terms of their access to services. Unfortunately, the technological solutions that are being provided are only likely to deepen these inequalities rather than address them and have that transformational element of technology fulfill the potential that it needs to. So all for technology, all for tech-based solutions, and I think they are here to stay. I am not certainly thinking of a dystopian future, although I do think when we talk about artificial intelligence, there are big unknowns that we are working with, and we do need to address that. But looking at it as tech more broadly, I think we need to have some safety features, some regulatory aspects starting to put in place. Otherwise, we will be doing catch up for the rest of our life without necessarily addressing the kind of potential that this could actually harness for larger sets of population.
And who would put in place those safety procedures and that regulation? In your view, is that national governments, international agencies? Where does that come from?
I think it's national governments and them domestically and them coming together globally are the ones that are responsible, and then are the ones that have the authority. Unfortunately, and I think this was what was at the back of your question, the big tech companies that are running the show do not like to be regulated. And unfortunately, they tend to operate in what can only be described as an accountability-free zone right now. And so even the best efforts that we see coming from them are essentially those of self-regulation. And I'm sorry, that just doesn't work. They have to be held accountable because the kind of potential of harm and risk that can run, and in the last few weeks, from ChatGPT to everything regarding AI and its influence in different areas, it is becoming increasingly clear that there has to be a global consensus that has to be formed on how to use these technological advances, but also how to regulate them. But one has to be careful because what it easily gets argued out is that, oh, are you talking about censorship? Are you talking about putting curtailments, which is not what we are talking about. Nobody is talking about censorship. What we are talking about is regulation, which can ensure free use. Because if you look at it only from even a data perspective today, the way data is being mined, the way data is being collected can be very harmful. There have been cases now which are reported where search histories of individuals are being used in national level litigations to prosecute them for accessing services that are proscripted in their national context as such. Abortion is a very key example, which continues to be regulated by criminal legislation in multiple countries. And there are cases in the United States that are being reported where the search history of individuals are being shared as proof of litigation.
Okay, I was going to come back to discussion about the private sector a little bit later, but let me move on to that now. And you talked in the context of data, and that certainly relates to health, but how most of us think about the private sector is medical countermeasures. And so pharmaceutical companies, biotech companies that produce vaccines and diagnostics and therapeutics. And of course, we've seen, and COVID was very clear, right, how dependent on those big companies we were. For better, for worse, capitalism is the order of the day kind of in most of the area of the world. So how do you see that in that balance of needing the private sector and then the vulnerabilities that we have to the private sector? Are we on the right path? Does that need more regulation, less regulation? Where do you stand on that?
I don't think we are on the right track. I do think private sector has a role to play, but I think the question becomes is on what terms are we having that role to play? And one has to start from the basics on this, right? When you have state as the primary deliverer of services, as the custodian of social protection for the population, the state is working primarily with as a welfare objective. When you do have the state being replaced by private sector, the shift becomes from welfare to profit maximization, and market becomes the model that we are dealing with. When you look at it in the health sector's perspective, and global health being the big paradigm now, you have private sector, at least three levels at which private sector is engaging now. One is what you said, Dan, quite rightly, as we working in health are familiar with it in terms of, health countermeasures, pharmaceutical companies, the manufacturer of diagnostics, medicines, and so on and so forth. The second is private sector in terms of foundations, which are now funding a lot of global health work in different setups and in different frameworks that they are. The third is the private as part of the public-private initiatives. So the private as a financier of healthcare at the domestic level. Now, what we are finding is that in terms of, if you start with the third one, in terms of private financing of health, what is increasingly becoming clearer is that the private sector has almost crowded out public investments in health. It is disincentivizing the national governments to put in the kind of resources that is needed for them to do the kind of social welfare function that needs to be protected for. So the countries which were ODA dependent, if you look at the kind of falls in public level investments in health that is happening, is pretty dangerous. And it is happening also because at the cost of what happens when the private sector goes out. Now, in the last 2 years, since COVID-19, what we have seen is that the overseas development assistance has started to dwindle quite substantially. Overall, there are multiple countries which were big financiers of health who are not doing it, some because of the kind of cost of living crisis, the other because of their ODAs being diverted for relief operations like Ukraine and elsewhere. So what do you do? Now, because we don't have the public investment model in the countries, we are looking at a very, very difficult situation. If you go back to the second one in terms of private foundations and their dominance in global health, the big challenge that we are finding is that it comes with little accountability, but a lot of space in terms of how they operate. So they are able to dominate the agendas without necessarily having the kind of accountability structures attached to it. And in the first instance, I think one doesn't even need to make the case now in terms of the responsibilities of pharmaceutical companies in terms of accessing technology and sharing technologies and making sure that there is capacity available within the global south to do the kind of work that is needed. So to make sure that the supply chains are available in a manner which is more localized. But I think if you look at it across the spectrum, the conversation that becomes clearer is that private sector's role is there. It's formidable. I think what it keeps on coming back to is on what terms are we engaging with the private sector? Are there needs that we need to fulfill in terms of ensuring that there are not accountability deficits, the same accountability that we impose on countries? So why is it that we are able to ensure that the strongest of the countries are held to account for these responsibilities, but not private actors? And I think that's where we need to ask a question is how we can have a more balanced approach to engage with the private sector rather than an either or one.
Great, thank you. It's a very nuanced response to a very nuanced question, so I appreciate that. You mentioned COVID-19 and the pandemic, and I do want to come back to that. But before I come to COVID, I'm wondering, prior to the COVID pandemic, were there moments or events or things that happened that really made this nexus of health and human rights clear? Particular things that changed the course of this field? Anything that you would note?
Definitely. I think the HIV movement in the 80s and 90s was probably the touchstone, if I may, to the more contemporary health and human rights movement as we know it. Not only that, it led to the formulation of the frameworks that some of which we are talking about today, but also the application of it. What the HIV movement in the 1990s did, it shifted two things. One, it made the health and human rights argument very personal and very real to a lot of people. It was very esoteric before that. I think people thought this was a conversation in abstract that we were having before. It became very real. And one could see actually the application of it very real as well. When it came to the access to antiretroviral treatment and the differences in terms of the prices that were being charged, the famous treatment action campaign case that happened in South Africa, I think shifted needle in terms of what these health and human rights are about. When it talked about the key populations and people who were affected by HIV and how we talked about them, how we deal with these issues from a stigma and discrimination perspective, it started becoming very real, very applied, and very contextual. So for me, if I look back at the trajectory of the work on health and human rights, I think the events in 80s and 90s is where I think it came to fold. And then it started building up, whether it was then looking at issues around maternal health, sexual and reproductive rights, issues around neglected tropical diseases and access to treatments. I think that's where it started building up from.
And how do you see this COVID then, coming to COVID? What turn has it taken with COVID in terms of really building that or deteriorating that principle of health as a human right?
If I was to be reflective, I think what COVID-19 did, Dan, is that it made people realize successes were very fragile, and that whatever we had gained in the last 3 decades was very tenuous, and that it did not withhold the stress that the pandemic put it through. There are a few things that happened. First, I think it's important to remember COVID exacerbated inequalities and exposed them. The inequalities were already there. So we were not doing very well in terms of addressing health-related inequalities in a systematic manner. I think the divides within countries, between high income, low income, between marginalized populations and groups was altogether very real. What COVID did was basically, it just took the lid off and exposed it for what it was. The way we responded to COVID, unfortunately, showed the fallacy of some of the arguments. And I'll come to that in a moment, but it deepened inequalities and it pushed certain groups further behind than they were. So it made progress even more difficult. To me, the two things that COVID exposed very dramatically was, and this is almost was a bumper sticker in COVID-19, and Tedros in multiple conferences and press events talked about we are all in this together. The unfortunate reality was we were not in all this together. People who could afford, countries that could afford, had stockpiles of vaccines, and they basically were engaging in price hedging with pharmaceutical companies, and countries that did not were scrambling for a single dose. So, some countries had 9 times more doses and some countries had none. So that's what. So what it exposed was that this whole edifice on which some of this is based on of cooperation, of solidarity, just does not work. And the question therefore is, then what do you replace it with? And is there a way to make cooperation more meaningful? And we are in the throes of discussing the pandemic accord, which hinges on the idea of solidarity, of cooperation. But it says, and this is my second point, it says nothing about compliance and accountability. And that becomes the bigger question, is that then how do you hold people to account when they do not, when they do engage in populistic rhetoric, when they do engage in the manner that we all very well remember? How do you ensure cooperation? How do you ensure accountability in those settings, and what can we do about it? And so I think it's forcing us to think differently to a future, and to see the ways in which we can recalibrate not only our institutions, our frameworks and structures, but also on the more basic front, how do we engage with each other? How does research happen? And can we look at health as a global common? And if it is a global common, how do you finance that global common, and what is our shared responsibilities? And as some has said, so that it does not result in tragedy of commons, rather than a future that can address the sort of challenges we face.
So you mentioned the pandemic accord, and for people who are less familiar with that, and this is something being worked out, and the idea that of course countries are supposed to report when a particular event happens, but there's no real enforcement to that right now. And so a lot of discussion on how that would happen, and if you don't report, what would the consequences be? And I think we all struggle with that. Do you have any thoughts, Rajat, from a legal framework? What could be put in place that would make countries be more accountable in terms of reporting when events occur in an outbreak that might happen, for example, for our context, that has consequence to a global population, but a country chooses not to necessarily be a good global partner and communicate that information? Any thoughts how that might work?
There are people who are writing and who are thinking about this in multiple forums. People are looking at ways in which situations can be escalated, that there could be independent bodies that can be appointed to review the levels of threat, then can escalate it further up to General Assembly, to all sorts of other such procedures, and the independent panel has talked about some of these ideas. I think they're all very good ideas. I think we need to look at them all in their merit and discuss what is it that we are talking about. But if I may, I think a challenge is a bit more basic right now. As someone like you would understand, pandemics do not happen overnight. Pandemics do not just take place, right? They build up. It's a system of failures that lead to it. It's a system of inaction, failures, or events that eventually lead to a buildup. That is what it becomes. And even with COVID-19, you can see the kind of issues, and many have argued that there were probably events that could have or should have been picked up in different manners. The question is that, do we have systems in place that can provide that kind of intelligence data sharing, national level CDCs in place, institutions that can be reported into and can report upwards and sideways in terms of cooperation frameworks. We don't, unfortunately, have those investments. Countries haven't built up those systems in place. So I think when we do start thinking about what might a global accountability look like, I think before we get to that, we need to start setting up these things. Now, these are more data gathering, monitoring related issues. We do need to have institutions, and there are models that have been put in place, for instance, in the human rights work, and this is where learnings from human rights work could be very interesting, is in terms of peer review mechanisms, which can provide countries with the opportunity to look at it in a periodic way, how they are each doing in terms of their own national level preparedness, readiness around some of these things. I think that's a great idea. I think that kind of takes the pressure off certain, of a country that you have to, or in terms of what kind of successes or failures or challenges, but it becomes more in terms of information sharing and how you can improve. So it's more of a course correction model that can be built in, but at the same time, that gives you then the opportunity to identify where there have been systematic gaps or failures that can then be escalated upwards into a process that might need to be thought through. But I think, in my view, far too much attention is going at this point in terms of what a global mechanism for accountability or compliance may look like, without necessarily recognizing that the local and country level underpinnings of it are just not there. So even if we have that set up, where would it get the data from?
And so pursuing that a little bit, an interesting idea, if I understand it correctly, with those monitoring bodies, they would need to be independent, right? So if they're going to monitor the performance, if you will, or it can hold a national or a local government accountable, wouldn't they need to have some independence and arm's length, at least from the government, and financed by someone else? Otherwise, they would be presumably just controlled by the government and release what information the government would choose.
Indeed.
Yeah.
I think they will have to have some level of independence to ensure that the pressures of national level politics, of ruling ideologies, do not weigh down the kind of scientific rigor and the evidence and data that one would expect to be generated out of these things, out of these bodies. And we do have, right? You do have in countries where it works, we do have national level ombuds and commissions that are there, which are independently appointed by the government, which can be very well looked into as models that can be applied within the space. But we do, in the kind of situations that we are talking about, we don't have the kind of infrastructure. We only have recently set up the Africa CDC. We do need more investments of that. The region that I work in, we don't even have those discussions starting to take shape right now. So we do need to think about how we will have these representative bodies set up that can provide the kind of intelligence gathering and feed into these global setups that are being thought through.
Yeah. Okay. I want to move on. You actually alluded to it earlier. You didn't, I think, use the word, but equity, of course. And if there was probably one word that the COVID-19 pandemic brought into everyone's mind in every discussion, equity at least would be a candidate for the top one, because that's come up quite a bit. And so how do we, I'll confess, and I'll venture to say you'll probably share the opinion that we would be skeptical if we said if there was another pandemic today that equitable principles would rule the day. I don't think we're there yet to just say everyone should do the right thing and that will happen. So how do we fix that? How do we, what pressures or mechanisms or what's our solution to help people do the right thing?
Dan, I would want to question if equity is even the right framework for us to be thinking about. Equity is premised fundamentally on the idea that societies are in an upward progression, that things can be redistributed in a manner to achieve. We are in a fairly unequal world right now, which unfortunately is in a downward trajectory. We don't have the principles of fairness being applied in a manner that can make us think about whether populations have the same opportunities to achieve the outcomes that we would want them to achieve. So in that sense, is equity able to deliver us the kind of fairness objectives that we are achieving for? I don't know. I don't think so, is my hunch. I think we need to, and this is where building in an understanding of equity with a human rights framework becomes, to me, a far more interesting proposition, because it forces you to ask the questions about who determines what is equitable, how is equity understood, what are the principles of proportionality that we are applying, what are the contextual factors that we need to address while we look at equity in distribution of services. And I think this is where health and human rights as a conversation becomes far more useful than we have then looking at equity as we do in public health, which in my view is a more simplistic understanding of the challenges that we face right now.
Yeah, so how I interpret that, and I love putting this in the human rights framework and using that language, I guess, because it has the rights part in it, right? If you just say equity, it's so ambiguous in some ways, and it just sort of harkens back to a principle of everyone should play nice together. And rights actually, at least theoretically, has some provides a roadmap and an enforcement mechanism actually to have equitable distribution rather than just counting on goodwill, which I'd like to see the world that way, but I don't think that's probably going to be sufficient. But yeah, I want to move on to a couple. Our time is short now, Rajat, but a couple last questions, and turning more specifically really to our society. So we're the Society of Tropical Medicine, right? Our American Society of Tropical Medicine and Hygiene. We're a group of scientists and doctors and clinicians and public health experts. And most of us go through our training really focusing on that. We focus on the science and the patient. And I don't remember too many courses going through medical school and health and human rights. I think that would be 0 in my case. And most of us would say that we didn't get a lot of training or weren't really educated to think in this way. But how does your world meet ours, right? How do we have the same interest, right? You're a lawyer who's interested in health. We're scientists and doctors and all who are interested in health, but our worlds are somewhat parallel, I think, and often separate. And how do we come together to meet our common goal?
That's a fascinating way to put it, Dan. I have to say, I think our worlds do come together, and in my mind, our worlds do come together rather seamlessly, as and when we stand up for human rights. And I have to say, if I was to put my finger on what have been the failures in a recent past, but also in a distant past, is that of leadership. And is that of leadership of those in power to actually question power and their own privilege and the injustices that are happening around. And I have full admiration for people working in public health on the issues that we are talking about and questioning it. And this is where we have seen the biggest changes coming from, right? Had Jonathan Mann not had these conversations in the 90s, we would not have FXP, we would not have had the kind of conversation on HIV and human rights that we had. And then I think, so for me, our world comes together in ways in which we question the injustices, but also in terms of providing the evidence of what can be done differently and where the science is telling us that there is evidence to do the things and where we can bring our collective leaderships together.
Great, thank you. Last question, and it's one, again, very specific to our society, perhaps an unfair one for you, Rajat, but I'm going to pose it to you anyways. Our society began in 1903, and after a couple different iterations and names, eventually became known for many years now, more than half a century, is the American Society of Tropical Medicine and Hygiene. But we're quite international. We kept the American in the name, but perhaps more controversial is the tropical medicine part, and recognizing that really the tropical medicine is coming out of a colonial history. Certainly a history of people thinking about how do we keep the colonists healthy rather than those who are being colonized healthy. And so we think a lot about, what does that mean for us? Some discussions about whether one should change the name or not. I'm less concerned about the name per se, but rather just the principle. Are we in a position as a society of tropical medicine to be champions of human rights, or does that history somehow undermine that goal right from the beginning?
If I may say so, the fact that you're answering the question, that you're asking that question itself is a great starting point, I have to say. We all are having this conversation today, and we must have this conversation today about our own power, about our own privilege, about our own positionality in much of these conversations. The sad irony is that many fail to even now recognize that there is a problem with the way we function and the way we are structured, whatever our origins might be, but where we are. Somebody very famously wrote in a recent piece that global health is often understood as a humanitarian rescue mission of global North for the global South. And I think there is something very unsettling with that statement, and it's very true. At least that's what the origins of some of this work is. But I think the way I see societies like the American Society, like several others similarly situated with, can perform that role, I think is two things. One, as you are doing, is questioning your own power and privilege, which I think is fascinating, and and really good luck in those conversations, because they are not easy. They are very uncomfortable conversations, because that makes us question and challenge a lot of paradigms. But the second is where I think it can become very real, is providing the voice and space for those from global South to be part of these conversations as you look into the future for the society, but also for your work. And I think this is where the change starts to become very real, because I think we all want to develop on those learnings. It's just that how we do that in a collective manner, and can we create space for each other in those setups, I think is a very good starting point.
That's a perfect, I think, final comment, because it really does capture, I think, the challenges and the aspirations of our society. So thanks very much for that. Rajat Khosla, then, from university. Thanks for your time and your insights today. Really appreciate it. Really fascinating. And we wish you a good afternoon. And thanks everyone for listening.
Thanks a lot, Dan. It was a pleasure to talk to you. Thank you.